Everybody, welcome to our Natural Health News live show. It is officially Friday, it's the 15th. We're halfway through the month. That's so crazy. So welcome to all of you. Today is our live show where I answer your questions. So it's a Q&A live with Dr. Melissa Gallagher. That is who I am. I'm a naturopathic physician. I'm based in Atlanta, Georgia. And for now, almost the last 10 weeks, I've been hosting a live show for all of our viewers, followers, and patients who are at home in quarantine, staying at home, trying to be safe and well. So welcome to all of you joining. Let me know where you're tuning in from. I always love that we have a large international community. So welcome to all of you. I have a ton of questions. I have pages and pages of questions that I'll first start off with after our news. And so join me this morning. I am actually in full octane mode. I am drinking caffeine. So some coffee and quarantine. That's what's fun about our Fridays. Oh, excuse me. So welcome to all of you. Tell me where you're tuning in and watching this live from. I've got a lot of news, a lot of printouts from the CDC. Specifically, they finally released an altered version of some of the guidelines. So we'll cover that. I got a whole bunch of details and visuals to show, as well as a warning health advisory out about children. And this is going to be really key as schools are starting to assess what fall, summer and particularly fall is going to look like. And speaking of that, Brian and I have a call with Gabriel School at 10:30. So this show will be 60 minutes. And at 10 o'clock, we'll be all done. So I'm excited to dig into some of the news. I have some good, healthy news to share with you, and then we'll dig right on into your questions. But currently, the world's ticking up. Other countries are coming online. But the U.S. is kind of at a slow, stable pace of 1.4 million cases. Our death rate has increased. We are at 86,571 deaths. That's significant. A few states to note: Virginia this week on Wednesday, they reported 1,000 new cases. So I'm not quite sure what the deal is with Virginia, if they've come online with maybe CVS and Walgreens for testing. But there's something going on with the increase, and I don't know the details behind that, but I'm sure we'll find out. Friday, I try and be as positive as we can. We have to celebrate our oldest survivor here in the U.S. Woo, woo, woo. Let's give it a little hands up for a 108-year-old woman out of New Jersey. She was a born New Yorker, lived in New York up until, I think, 10 years ago when she moved into a nursing facility. And she survived both the Spanish influenza. She was 6 at the time. And then she survived COVID-19. So that is awesome. Talk about amazing genes and just the capacity of the body to recover and heal. So if anything, I didn't catch her name, but she's out of New Jersey. And I think she is such a great testament to hope. So we have to hold on to hope and know we will get through this. So we'll get through it together. Science and research. You guys know I've been pulling and printing a ton of articles. I'm excited to share the fact that science and research is really on the huge increase in terms of COVID-19 and studies. Some of the noteworthy points of that. One of the non-peer-reviewed clearinghouses. It's basically a server. It's like a MedRx type of server, where anybody who's doing any type of clinical, like true clinical research, can post before it actually gets reviewed and then published in any of the journals. If any of you have not been exposed to journal publishing and articles, it takes a lot. You jump through a lot of hoops. There's a lot of mechanics and methods and procedures necessary to put together these papers. And the fact that we are in a novel virus that's, less than 5-6 months old, the fact that we have science and research just blowing up. One of the journals has said they have an increase in daily science and research-based journal articles, research, data, studies, at 110 to 150 submissions a day, which is mind-blowing. And that is it really equates to all these other journals where they're seeing a 5-fold increase. So 5 times the amount of studies and research are out there. So I'm trying to stay up on that. I have my kind of go-to journals that I always pull. But just know, like the New England Journal of Medicine, which I highlighted yesterday, they're even publishing early stages of information, because what the goal is with science and research is to get stuff out there so clinicians, frontliners, can take the data and then maybe re-articulate what their treatment plans are. So speaking of, a huge study was just published about, I don't even have enough, I'm still waiting on ink. So I don't have enough juice in my printer to print out the 80 pages of this report, but I did read it online. One of the things that's pretty phenomenal is they pulled a substantial caseload. 5,000 patients have received what they call convalescent plasma transfers, or they're receiving antibody-rich plasma from donors who survived COVID. And the outcome is extremely positive. And they have multiple cases. And this is stuff that we're doing here in the US, but it's also happening all over the world. But this is pretty substantial. So it is now deemed as an okay and safe experimental therapy. So they've been experimenting with this. This is not the first time we use plasma with antibodies. They've used it in SARS, they used it in Ebola and other challenges. You know, Brian and some of his ITP, he's had immunoglobulin transfers and things like that. So, or transfusions. That is significant. So this may be one of the complementary protocols. Now we see this from Desivir and some of these other ones that might be this kind of 5-part protocol for addressing these cases. One of the substantial finds in this is that people who literally are nearly at death's door, they get this transfer, and within 2 days, they're breathing better, their oxygen levels increase. So the immune response to the plasma full of the antibodies from a newly recovered COVID patient are significant. Peter is on. Good morning. Happy Friday, Peter. Peter has just delivered an Australian $5 live super chat. Mwah, yay. Thanks, Peter. Yay. Making my Friday. Thank you. Thank you. So that's really exciting stuff, really important news. And the other thing too, if you or anybody that you know who may be hospitalized or in any type of exposure risk, they need to know that this is an option. And I don't know yet if we have a list of all the different facilities that are running these. It's clear in the research. You can see who all's been involved. But this is something too, it may determine maybe which hospital you go to, or choose to go to, or drive yourself to, or ask if you are in a setting, because that is showcasing a formidable positive in terms of a potential treatment. Nothing is a cure. This is all just part of a treatment protocol. And we are going to be seeing the building of what works and then the ironing out the logistics behind it. Okay, so the other thing that I want to highlight is that the World Health Organization, usually every Thursday, have either Thursday morning or like Friday morning, they have a conference where the director has his kind of press conference with details. The World Health Organization is predicting that Africa, so we're seeing a rise in cases in Africa, and that's globally across the world where we're starting to see uptake. They are predicting that the entire continent of Africa will see 250 million cases. Holy moly, that's a lot. So let's just think about all of the stuff that we're going through, all of this specific research, and then we're a first world country. Take that to some African tribes that are living in huts, that are getting exposure because of farming and, a lot of soybean production and whatnot. A lot of stuff's moved to Africa. That's going to be significant. And so the other thing that will be significant with this is the need for PPE. So if 250 million people in Africa alone are projected to be exposed, that is going to greatly overwhelm all these Doctors Without Borders. And I have friends who've done that. It's pretty, which means it's not going away. So, COVID-19 is one of our newest unwelcome friends, and colleagues and family member that nobody really wants to have in the party, but it's here. And speaking of parties, one of the things that they're looking at, and I'm still in this whole wedding planning mode because we pushed it out. And now there are these things called there's the new term for your save the date, but it's like a new date. So fun times. But one of the things that they're talking about is even I read a loose study that looked at just an analysis of super spreaders. And because of contact tracing, we can identify, these areas in Illinois and Seattle and Boston, like these super spreaders. And all of them have in common gatherings where there's a lot of celebration, lots of talking, respiratory droplets. Singing is a really big thing, which is kind of interesting in terms of the volume of respiratory droplets that are coming out of the mouth. But it really puts some strain potentially on wedding plans like ours. We postponed, but in April of next year, we might still be in this state. Who knows? So I just put that out there. This is really kind of key. Parents in Louisiana, 5 or 7 parents have come together. They are suing the juvenile detention facilities, that whole system in Louisiana. Children who are detained for whatever, juvenile crimes, they're in basically like a juvenile jail. But these detention centers are very similar to jail. There are these clusters, they're seeing more cases. And because now we have these CDC warnings, this inflammatory syndrome with kids, this puts a lot of kids who aren't under parental care at risk. And these parents are heavily concerned because these facilities, at least in Louisiana, they're not contacting the parents. These are minors. They're not contacting the parents when they test positive. They're not contacting them when they go in or out of quarantine. The conditions, these children are running fevers and they're put in rooms, maybe in isolation, but have no air conditioning. They're not social distancing. They're not using the proper disinfectant materials. And this is something that I read also about the jails, which is kind of fascinating. But the jail minimizes alcohol exposure, for if somebody would, utilize that to drink or whatnot. That's one of the reasons why the jail I highlighted the other day, and clearly Louisiana doesn't have this in their juvenile detention center, but this is what jails are investing in now. Some jails, this is in Wisconsin, this is a UV sanitizing robot. That puts a greater risk of also that super spreading experience and clusters in that environment. But these parents are saying they want their kids home and to minimize their risk. So, I just can't even imagine if your child has done something, they're in lockdown and you are not being notified, you're still their parent. It's just insane to me. So I want to end our news. There's two additional tidbits. New York. So apparently there was this rogue hairstylist in New York. It's making lots of news. You'll totally hear about it all day today. Hairstylist defied the orders and decided to open and has been cutting hair. So barbershop in Kingston, New York. So not in New York City, but north of it. Has been cutting hair for several weeks. And he tested positive for COVID-19. So now not only has he violated the state mandate, he wasn't implementing safety guidelines because, again, the CDC hasn't really been that descript with regard to these guidelines. And we'll go through that. But this is really insane because how many people have come into contact with this guy's facility? And now the contact tracing, it's mostly on him because each state has a certain number of contact tracers. Some have 3, some have 15. But that's a lot of people to contact trace with. So it's just kind of, it's just crazy. So June says the barber is about 30 minutes away from my area. It'll be interesting as this gets notated and they start pulling together all the people who've been in contact with this gentleman. Who knows how many he's affected, and hopefully hopefully there are no fatalities for this. I mean, this is where the liability as they're coming into play, and he is going to be liable for his lack of discretion, his lack of social distancing, his lack of adhering to mandate. It's going to end badly. For 3 weeks of income, the offset is he is put people at risk. People may die who have had exposure because of him. So this is very challenging. And at the end of our live show, I'll tell you the story of what I did yesterday. I got into a little bit of a Facebook mommy group tiff with a new small business here who has clearly no idea what they're doing. But I ended up, I'll tell you, I made a call to the state health department because of it. So stay tuned for that if you want to hear. I got really fired up yesterday. So the other thing, unfortunately, they're expecting, because of the economic status and just the degree of overwhelm that the virus is placing on folks that are in the lower socioeconomic stratus, the expectation is that we will see an increase in homelessness of 45%. And they were articulating in some areas it's going to be like 250,000 individuals will be homeless, it's heartbreaking. And then a lot of the facilities that could cater to them are closed and mandated closed because it's, not social distancing and it's in close quarters and it's risky. So that is problematic. And then on a positive note, FSU medical students, my undergrad is from Florida State University, and we have a small but growing medical school. The medical school, two young girls, started a website, and it's called Kindness Amid Coronavirus. And it's kindness and then a dash and amid-coronavirus.com. And they're piecing together individual stories of acts of kindness and all around the world. And they map out, they put a little kind of bullseye point on where you're at and highlight your act of kindness. So if you guys are inspired or want to submit yourselves or anybody feel free to do that. It's really great. But I will post that website down below after this gets wrapped. Quick little note, I just want to cover, I'll post this link as well. The CDC's got a new health advisory for pediatric care providers and parents. And this also will be something that schools, daycares, and any facilities that are caring for children will be attuned to in terms of just the growing number of children who are coming down with this really unique multi-system inflammatory syndrome. So it is not an overly whelming, extensive detail, but it's definitely something that they link to a lot of really great resources. Actually, I've highlighted for you guys already in the course of the last few weeks. But I want to dig into what the CDC has put out. So I was expecting this to release May 1st. So I've been looking on the CDC website. This is a little bit of a watered down version. We know this because the original leaked because the administration wanted to table guidelines of any sort like this. But this is what us businesses are relying on for when we're assessing how do we open up, what are our guidelines? What do we need to do? And so they have childcare programs. So they've got a breakdown in some categories, like childcare programs. And basically, it's should you consider opening, and some details. What is different in this from the original? The original said that if there were any increases in cases in your area or cases on the incline, that would not be the cause to open. They've removed that. So this is one of those scenarios where it's kind of a rogue, Wild West, if you will, of folks choosing to open or not. But essentially, it talks a little bit about, are you ready to protect children? And are you able to screen children and employees? So if you answer no, don't open. As well as, are you opening within the consistency of health and local, state and local orders. Then they have, some measurements like, are you implementing health and safety actions? Like, are you promoting healthy hygiene practices, hand washing, employees wearing a cloth face mask? So this is something CDC now, the guide for businesses and healthcare, anybody, the employees and employer should be wearing face masks. So if they can't do that, they need to meet the safeguards before they open. So this is just kind of a checklist. Like if you are yes, 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 you move to the next phase. If you're yes, yes, no, then you need to get all this gathered up. So they dig into, training employees, adjusting activities and procedures to limit sharing of items like toys, belongings, supplies, and equipment. That is very broad in terms of childcare. And this is totally what Brian and I are talking with the principals of Gabriel School today. So we need to figure out what this is going to look like for us. And, it's just crazy. And then the idea of ongoing monitoring. So they want some sort of procedures to be put in place for signs and symptoms of children. Now we know children are different. So this is just kid oriented. But anybody who's sick, they need to stay at home. Planning for if children and employees get sick, regular monitoring, and then having pools of substitutes. So it's, excuse me, it is not overly comprehensive. This is their workplace. So this is what all business owners, companies, this is our guide, 1 page. So, there's 2 basic things that we have to consider. Is reopening consistent with state and local orders? And are you ready to protect employees at higher risk for severe illness? So if you say no, you don't open. If you say yes, then you move to the health and safety guidelines, very similar. The big thing is consider modifying travel and commuting practices. Promote telecommuting. So like Brian's case, promoting staying at home. The other thing is encouraging social distancing. So putting physical barriers between people, changing layout of workplaces, encouraging teleworking, closing or limiting access to communal spaces. So the coffee bar, even some of the gathering areas, corners and nooks, library, conference rooms, probably not a good idea. Staggering shifts and breaks, so minimal contact, and then limiting any type of large events. Really the number on large, 10 is that still the threshold. YouTube's buffering. I'm sorry, you guys. I don't know what is going on with this. It's still crazy. So if you're encouraged by this or like this info, please give me a thumbs up. Jenny from the Block's totally on point. So please I encourage the thumb up for all of you who like this. The other thing they want is, regular monitoring, encouraging people who are sick to stay home. We need a plan, but we don't know what the plan looks like. So it just says plan for if an employee gets sick. So that thread I mentioned yesterday, I was on with other practitioners. What do we do if one of our employees, our front desk person, our scheduler, our, anybody in our office gets sick, or a customer, patient, employee gets sick. So that's not really been outlined very well. So this is very general, but it's out there now. There are 2 new things that came out. This is a little bit more extensive. The guidelines for cleaning and disinfecting. So this gets specific in terms of guidances for all Americans, whether you own a business, run a school, or want to ensure your cleanliness of your home. So this is it for all of us. And they talk about, the spaces, and workplace, home, school, and business. Talk about developing a plan, implementing the plan, and maintaining. And basically that's what they go through. So they go through, some ways to lower the risk. They link a lot to previous articles they posted, developing a plan. They even detail what needs to be clean, and how there are different surfaces. Do you use disinfectants? Do you use soap and water? outdoor spaces. They give the FDA an EPA approved disinfectant list, which, by the way, Force of Nature is on there. We love them. And they've got a great coupon for May without you being overwhelmed by the toxicity. And then they want to also have, like disinfecting everyday use items, the unoccupied for 7-day items. And then how do we clean hard and non-porous like glass, metal, and plastic? And then they have a list. They actually do list some of these specific items like doorknobs, keypads, tables, countertops, handles, desks, phones, toilets, faucets, sink, gas pump handles, touchscreens, ATM machines, all those ones that I've been kind of warning everybody to stay away from the beginning. This is what they want to see folks trying to clean in the office space. And then, it is not, there's a lot to this, but it's not overwhelmingly comprehensive. 3 pages are a breakdown and links to other guidance that they have. So they link to the long-term care nursing homes. They have different guidance. They've got checklists, dialysis facilities, blood and plasma facilities, alternate care sites, dental settings. So there's a specific dental pharmacy guide, outpatient ambulatory care. That's where we would fall in for us. Post-mortem care, and then critical infrastructure, schools and childcare, universities, gatherings and events, faith-based events, businesses, parks and rec, law enforcement. I mean, literally, they go into retirement homes, correctional facilities, law enforcement, and then the home setting. So I'll link to this. It's decent. It's not the most comprehensive plan. It's much more comprehensive than our 1-pager about coming back to work and what we need to do to make it safe. And then they've got just a 2-pager kind of visual guide of, cleaning and disinfecting, indoor if it hasn't been cleaned in 7 days, frequently touched surfaces, and then the material. So there are 2 types of kind of areas, the hard non-porous and then soft and porous. So like carpets, rugs, and seating areas. They actually recommend removing soft and porous materials from high traffic areas, meaning we have, for instance, at our facility, we have a front desk. We have a carpeted, so we have all wood, bamboo floor, a carpet where there's a coffee table, and we have a couch and 2 chairs. So under this, we would need to remove a lot of those things and probably replace our couch and the chairs and the carpet, totally remove those and get things that are more easily cleanable that would fit into the hard, non-porous material. So maybe plastic chairs. That's just one of those things. Like we just have to kind of start thinking like how we see our world when things kind of start to get moving forward. Things are going to look a lot different. So I'm putting that out there. Okay, so take a sip of coffee. We're halfway through our morning. Yay. Happy Friday, everybody. Jana's loving her Force of Nature. She says, I can't believe how well it works on general cleaning besides the disinfecting aspect. It's freaking fantastic. We use it on everything. I use it on my monitors. It's so gentle. I use it on my phone, on like everything. We use it on our dog's paws. It's good, even outdoor. Okay, so I posted a question to Instagram and YouTube yesterday and just said, hey, you guys, ask me questions. Tomorrow's our live show. So I've printed them out. They printed a little wonky for some reason, but I'm going to go through and specifically dig into your questions. So I'm going to start with my friends over on YouTube. We had a lot of questions, a lot of comments come through. And I just want to kind of go through these. So let's start off with, excuse me. We got lots of questions. Okay. I'm going to try to get these in order. I told everybody I'd do this in order. Okay. Here we go. Okay. So Deborah O'Reilly Christensen. So she asked about blepharitis, and rosacea. So blepharitis is a kind of reddening, an irritation, inflammation of the eyelids. And, kind of when you pull your eyes down, you can see redness, and rosacea. So she wants my thoughts on both of these. So rosacea tends to be, and for any of you who don't know what rosacea is kind of a reddening of the skin. And sometimes it'll mirror that kind of Hashimoto's red butterfly effect. Sometimes the two go hand in hand. But both blepharitis and rosacea are inflammatory related. So it's a skin and mucosal condition that's inflammatory. Blepharitis is mostly irritated by bacteria imbalances. So two things: digestive health, we need to clean up and create a more robust microbiota in the digestive tract. And then there are homeopathic eye drops, and I would totally use every night, especially if you wake up crusty and gunky. I would do an eye soak with chamomile. So I've highlighted a little bit, but chamomile tea is really good for eye issues, conjunctivitis, blepharitis. Even the allergies I get, my left eye is always a challenge. Like I end up tearing my contacts, and it's just irritating. That chamomile is just great for eyes. Rosacea, I actually implement a different skincare regimen for the rosacea patients because we want to minimize the outer skin irritation, and then we want to deal with the internal. The other thing too is I find that folks that eat high spices or have any type of food-related allergy to spices will often have rosacea. Okay, so Anj Patnaik asks, what causes ears to get hot/red? BP is normal. So I'm imagining it's the earlobe. Sometimes that can be energetic in terms of like anxiety or stress. And if it's stress related, that's cortisol. So we want to manage the cortisol. The other thing too is depending on when you're getting hot red, it could be food-based allergy. So I'd monitor, and basically in this type of situation, have you get a journal and monitor every time it turns red or hot, and then notate what you were doing an hour or two before. It could be seasonal allergies. It could be an allergy with it, like an ear pillow. But there's a lot to that. It's hard to tell. Okay. Blessed indeed asks, address varicose veins and a nodule benign on the thyroid, and then calcium. Okay. So we'll start off with number one. Varicose veins. I'm getting very friendly with the varicose vein I'm dealing with in my leg. We're trying to figure out if it's stress related, which it might be, or if it is just part of some DNA that I'm not aware of from one side of my unknown family. But varicose veins are often genetic in your predisposition. They can get triggered by changes in weight, mobility. So sometimes when you stop exercising and are less active, the sedentary aspect can be a factor. Varicose veins are often vascular in orientation, so blood flow impairments. It can also impact the lymphatic system. So the key is to identify the root cause of it. Sometimes diet, weight is a factor. Pregnancy is a big one. So a lot of times women who are pregnant will have varicose veins. And then also sometimes lower abdominal cysts or tumors can infringe on the blood flow, but usually there's something to the blood flow that's being infringed. To address that, there's a lot of different things that you can do. I like the herbs that are going to enhance the blood flow, like butcher's broom's always a big one. And then even the pine bark that I had highlighted before is really big. I actually have a few videos on varicose veins, so I'd recommend that. A nodule benign on the thyroid, how to get rid of. So this is an excellent question because a lot of us, I've even had a little tumor on my thyroid. It depends on what type of mass it is. Are we dealing with a fluid-filled cyst, or are we dealing with a massy, potentially vascular tumor? Nodules generally will come from an imbalance in the thyroid gland itself. Sometimes they're accompanied by a condition like Hashimoto's. Others are there because of stress-induced thyroidal imbalances. So we have to peel back the layer and identify what's the source or cause of that. Sometimes it's a lack of iodine. So depending on those factors are the routes that I take. For a lot of my patients or folks like many of you who watch my channel, I actually have a ton of digital guides that you can purchase and download that dig into. I have 4 thyroid ones. So just a general thyroid, just want to keep your thyroid healthy. If you have Hashimoto's, that's specific. If you have hyper or hypothyroidism, then there are more details than that. But I often find that mineral deficiencies are a big factor with the thyroid nodules. And for sure, eliminating the dietary elements like gluten and dairy are very pro-supportive of your thyroid gland. Calcium, should we take for bone health senior? One of the things with calcium, I find that we're okay on our calcium intake. We just are not well on our articulation or our absorption, which means a lot of times we do not have the other minerals we need. We don't always have the K2. We don't always have the vitamin D, the magnesium needed for the right assimilation of calcium. And then it gets rearticulated into our vascular channel. That's where we get arterial sclerosis. There's an actual like bony, literally your arteries turn to bone. It's crazy. So what happens is in that type of setting, depending on if there are those underlying health concerns, it's not always the calcium that I want to get to improve bone health. I want to look at D, K, and magnesium. So micronutrient testing is really good for that. Okay, so more questions. Jingle All the Way says, last week when you discussed hair loss due to stress, you said that it was possible to reverse gray hair. I'd like to hear more about that. And by the way, I ordered the shampoo bundle and really like it. Okay, so gray hair, this is one of these multiple kind of layers of detail. So gray hair can be genetic, it can be stress, it can be micronutrient deficiencies, and then there's just the kind of natural aging process. So when I look at how do we reverse gray hair, first and foremost, we need to do a micronutrient panel. So we need to look at your mineral intake. We need to assess your copper levels, copper and magnesium. There's balances too. So we actually will look at ratios of certain micronutrients, because in the mineral world, you maybe want 3-to-1 on some, and maybe you want 1-to-1 or 2-to-1. But the ratios are critical, just like the estrogen progesterone ratio is critical. Same with your minerals. So copper tends to be one that I want to look at. I want to see, are you deficient? Because copper alone is helpful. There are the over-the-counter, things like rosemary oil, and even folks will do onion oil and things like that. But for me, the way I look at it is gray hair tends to be indicative of the body lacking in micronutrients. So that's number 1. 2, stress. So a lot of times, and this actually happened to my grandmother, my mom's mother, poor woman had in just crazy scenarios in her life. Her first husband died suddenly when she was in her 20s, and she had 3 little boys. And like overnight, her hair apparently went white. And like, that's a stressful situation. We see this in friends and people that we know that have cancer. All of a sudden, when their hair starts growing back because of all the treatments, they now have lost their color, or their color changes. So stress can do a lot to the hair follicle. It can also do a lot to the color and texture. Same with pregnancy. So the gray hair, it is possible. What we have to do is first evaluate your minerals and look at that. Let's see. Passion Paradise, is taking vitamin D3 better than just vitamin D? And if so, why? Thanks. Love your channel. Okay. So Passion Paradise, vitamin D3 is absolutely the best form for you to take. It is the most bioavailable, and it is the synthetic. It's a synthesized version that we need to support our cells, our bone, our soft tissue, our hormone health. Vitamin D, vitamin D, and there is no like vitamin D. Oh, blessed indeed, indeed. Just offered a $20 live chat. Yay. Thanks for your question. So I appreciate the live chats, you guys, or the super chats. That's so grateful. It totally supports our channel. So thank you. Vitamin D3 definitely is where you want to go. I have a free download that details your dosing. And so Morris and Monica says, which D is the best one? Vitamin D3, not D2. D3 is what you want to take. Nancy Bergen asks, your thoughts to HTMA, which is hair tissue mineral analysis. I'm assuming that's what it is. That's our abbreviation. And that's what I've recommended for Jingle All the Way about the gray hair. And even with Blessed Indeed, one of the things with thyroid, we want to evaluate, do we need more chromium? Do we need more selenium? Same thing with men and prostate challenges. So that would be one thing. Nancy says, severe hot feet, what can cause it? Well, that is a very interesting element. Severe hot feet, depending on if they're physically hot or they're red or they're sweating, can tell us a lot about what's going on. But feet are a big indicator of vascular lymphatic imbalances, as well as thyroid and even digestive health. So, that type of question is so broad. I don't really have all of the details to dig further in. But, with severe hot feet, there's definitely some sort of energetic disconnect if you're getting that heat in the feet. I'd be curious how far up it goes, if it's ankle, up to the calf or the knee. You always want to watch for any reddening of the skin because sometimes cellulitis can be a factor, especially with many of my patients that they don't have the right proper lymph flow movement, and then they have immune challenges. KSBJJ777 asks, what calcium supplement is the best? So this is kind of similar going back to Blessed Indeed. So I actually personally do not take a calcium supplement because I feel I get, and my levels show, I have the right levels of calcium. What I need to do is I need to always keep my magnesium optimized and my D at an optimal level to enhance that absorption. So it's not always calcium that we need. If you're looking for strong bones, which is usually the mentality of calcium, then we need to recalibrate our thinking. It's magnesium, vitamin D, and then we also want to look at K2. And so those are 3 supplements and minerals and enzymes that are needed, or not enzymes, but hormones. They're needed at helping your body articulate calcium. So it's not always calcium that we need. And yesterday we talked about kidney health. I talked a little bit about the, I think I took it back to the, my little supplement section. I talked a little bit about Moonstone, yesterday's video sponsor. And a lot of people have excess calcium. So you don't necessarily want to be supplementing unless it's absolutely critical, but you need to accompany calcium with D, magnesium, and K2 across the board. Don't take it alone. Okay. I'm sorry. I totally botch people's names. I'm sorry. Ivelisse Bouet asks, I know you did a video related to children, but I needed to know if it's safe for me to give my 5-year-old turmeric tea. Totally safe. I gave her fennel tea for her digestion. I'm just not sure on turmeric. Yes, it's safe. I don't know if she'd like it. That's why we have the little chocolates, the Good Day chocolate, turmeric chocolate for Gabriel. It's got 500 milligrams. He's happy because he's got a chocolate treat. I'm happy because I use it for him to get his academics done. And he's getting turmeric. This poor kid's going to wake up someday and be like, my mom tricked me all my childhood. Okay. So Lena Kaner, always feeling bloated, metabolism really slow, need help with trying to figure it out. I exercise, eat fairly clean, drink lots of water. So bloated feeling and metabolism really slow. I look at hormones. And so we want to measure estrogen and progesterone and cortisol. And then metabolism, that's a thyroid thing. So if you haven't had that panel of assessing your female reproductive hormones plus adrenal health, and that's saliva oriented, and then also thyroid, do have that done because all of that's mixed in. And so you might have an imbalance in that progesterone estrogen ratio, the bloated, depending on if you're feeling bloated in the midsection or feeling like you're holding a little bit more squishiness, in the mommy pooch and like the lower flanks, thighs, and butt. That could be cortisol. That's where we kind of store cortisol. So stress is a big factor on hormone balance on that. Carla De La Hoz, I hope I said that your name right. She says, can appendicitis be cured with the use of detox formulas and probiotics? In my case, surgery wasn't necessary right away. Plus, coronavirus makes all surgeries a bit more delicate. I was prescribed 2 antibiotics per 10 days, 5 pills a day. Whoa, that's a lot. I am done with them and feeling great, although I do feel something going on down there every now and then. Of course, I'm being conscious of my food intake and amount of water per day. So it depends on the degree of your infected appendix, but a lot of times probiotics and prebiotics are critical for creating a healthier microbiota. I don't do detoxing when we're in a state of an infection, just because that's not what we call a clean elimination route. So like, for instance, you don't want to do a detox if you have an asthma attack or lung challenges or allergies. You don't want to do a detox if you have constipation or irritation or an infection. So this would qualify in that category. I would not do detoxing. That's too bold. It's too overwhelming to your system. But what I would do is I would add in things like aloe vera, slippery elm. Those are very powerful, soothing, calming. You got to think about it. It's basically a pus-filled, and it sounds gross, but this is reality, friends. She has a pus-filled appendix and it is filled with junk and fecal matter, and it's just quite overwhelming. It's an infection, and the degree of antibiotics, now you've wiped out a lot of good bacteria. So definitely probiotics, prebiotics, inulin fiber would be the course that I would take. And definitely, depending on the degree of the infection, you can have scarring as well. So I definitely watch my scar reduction video as well for that. April says, what probiotic is best for a woman? Which do you recommend to maintain? Well, everybody's bacterial level and bacterial balance varies. And so what's good for you and me, totally different. So there are some ways to address this. I like to implement high strain probiotics just to get a broad range of bacteria. Excuse me. I also like to include any type of prebiotic. I like lots of fiber, like inulin fibers. Chicory root is what we call inulin fiber. That's very powerful. But every month you want to switch. So you want to move around and, take different probiotics. Not one is the best for everybody. And so just experiment and switch between high quality brands. And the other thing is, not all probiotics absolutely have to be critically, they don't have to be refrigerated. That's the one thing we know with research, that's not always the case. Lily asks, how can I get rid of fibroid and balance estrogen and progesterone naturally? Well, depending on your levels, there's a lot of different ways to do that. Most of the time, fibroids are an overabundance of estrogen and a lack of progesterone. Often there's an underlying thyroid element, there's an underlying cortisol imbalance, and there's an underlying testosterone abundance. And so you have to address all of those collectively and individually. And then depending on where the fibroid is, I'm assuming it's in the uterine lining. There are all different types of fibroids, and even in the breast tissue. So that it all varies. But there are ways to do that, but you have to delicately address all of those aspects. I have a lot of video content on that. I've suffered from a fibroid and a polyp I've resolved without surgery. It's totally possible. I've had a lot of different things happen where, traditional medicine would say, oh, you need to take a pill for like the rest of your life. No, thanks. So I'm sharing that because everybody's body is unique. But the most important thing is don't stress about it. Make sure you get your sleep, get your micronutrients, and then very specifically test and evaluate your hormone levels. And every 3 months, I would monitor that because a little tweaks can go a long way. Okay, little girl blue 46. Friend suffers from repeat asthma, bronchitis, pneumonia, antibiotics, parasitic challenges cycle for 2 years. Have been doing nasal rinses, nebulizing ginger, etc. What would you suggest for next steps, and what actual tests could be done to figure out the root cause? Okay, so with a kind of repeated case of chronic asthma, bronchitis, pneumonia, antibiotics, 2 things. I would want to have cultures, candida cultures, and cultures as much as they can get. They can even spectum, the spectum, that's the phlegm. They can culture that. I'd want to know what type of bacteria we're dealing with. It may very well be mold. It could be Lyme disease. It could very well be just an overabundant kind of immune response, an allergic response, an inflammatory state, could be mast cell. So there's a lot of different things kind of underway and underlying that. But big thing is start to eliminate environmental factors. So all external allergens, internal allergens. So get rid of and start to evaluate food-based allergies. No dairy for sure. No dairy, no gluten. Start healing the gut. The respiratory passageways mirror the digestive system as they're a detox organ. The other thing too is asthma and bronchitis. If this is chronic and the individual's been dealing with this since childhood, there's probably a lot of scarring, and that scarring can be a harboring space for bacteria to overwhelm itself. I would look at, in that particular case, doing some biofilm detoxing. And I say detoxing, it's not detoxing, but literally you want to get rid of some of the biofilm, and that's the mucky, junky sludge. Basically, bacteria is like a slug, and it has this like slime trail. The slime is what we call biofilm, and that's how it harbors itself. And in these type of very mucosal areas, there can be a lot of biofilm. So I would do that. And that individual might also have a lot of dental caries or plaque or a little bit more overwhelming like gum challenges. That's also indicative of biofilm abundance. Okay, so now I'm going to move on to some questions that came through on Instagram. And I do have to tell you guys, I do have to run at like 10:05. So I'll make sure I get to some of your questions as well. Okay, so let's see. Salvage Goods Seaston. Any herbs or minerals or other suggestions to strengthen the heart after a heart attack? Oh, this is excellent. So I actually work with a ton of cardiovascular cases, sometimes right out of ICU, and they're convalescing in rehab, or they're recovering. The most important, CoQ10 and PQQ, that combination, spectacular. I've had patients who've worked with me immediately. We've got them on all the right regimen. Herbals, CoQ10 is not an herbal, it's a coenzyme, but it's what the heart tissue and gum tissue is made of. And when there is a heart attack, there's usually some degree of a deadening or a lack of blood flow and oxygen to certain areas, chambers, sections of the heart. That part will, they kind of identify on a scan like that's a dead tissue. Well, the good news is we're always rejuvenating our tissue. And so you can recover and repair that area with CoQ10. Scientifically, like the Japanese use it in extensive doses. Like they do IV therapy, they reverse heart disease with CoQ10. This is not something that's not founded. We just don't do that because honestly, Big Pharma has a much greater stake than hooking people up to CoQ10 IVs. So I would do high doses of CoQ10. Now, obviously, consult with your cardiologist. CoQ10 can be a blood thinner. So if you're taking warfarin, which is very common, depending on a heart attack, there could be stents in place, there could be valve replacements. There's a lot of other kind of stuff you want to play around with, but definitely talk to the medical doctor, even the PA or nurse practitioner in that clinic. We do know that CoQ10 can recover and repair heart damage. It's very powerful. And a lot of the cardiologists that work with my patients on their next scans are like, whoa, what have you been doing? Your heart looks so good. And this tissue is no longer dead tissue. They will always say, what have you been doing? And they say, oh, I've working with Dr. Gallagher and I've taken CoQ10. And the doctor will go, oh yeah, I should have prescribed that for you. So, but you can get CoQ10 off the shelf, not necessarily at a pharmacy. So it's a different mindset. Okay, so Sheila Holland said, good morning. My recent blood work showed that my EGFR was 50 ml. I'm 55 years old. You are in lucky, Sheila, because I literally didn't put this away yesterday. Okay, so you're 55 and it's at 50 mLs. Okay, so 55, you want to be at 93. And I'm assuming we're talking about the same metrics. Sometimes that's a big factor, but 93 is where you want to be on the EGFR. So that I would call the office and ask them if you are at the level you need to be at, and if you had any diagnosis for any type of kidney disease, call and find out, because that does appear to be lower than where you would want to be. That's lower than the 70-year-old range. And you'd want to find out if it's specific to one kidney or both. Okay. So yeah, CoQ10 is amazing. I love it. Ruchi Joyce. Hey, Ruchi. She says, also, what could be the cause of muscle twitching, especially in the legs? Thank you. So depending on if you're sleeping or if you're awake, magnesium deficiency is a big one. Thyroid imbalances. I know that sounds really crazy, but even restless leg can be thyroid related. And then the other thing too is sometimes it's electrolyte imbalances. So sometimes the minerals. And it depends on what all is twitching. So I want to know more. Like I actually have body mapping, so we can tell certain things about what's going on based on body types and areas of the body, even like scalp or head, hair loss, and things like that. She also asked, should I be concerned with having Hashimoto/low thyroid, although being treated and feel great in COVID-19? So thyroid disease is definitely an underlying health concern. The question is, does this yield other health concerns? Like, is it impacting your cardiovascular health? Is it impacting your blood pressure levels? It is in the autoimmune category, and any autoimmune, regardless of skin or glandular or, soft tissue, whatnot, it does put you in a risk category because it's the immune system and that autoimmunity is turned on. When you have autoimmunity in one area of the body, there's likelihood that you can develop other autoimmune components. I will say what we look at is we look at the digestive process. So healing the gut is critical because autoimmunity often is triggered within the digestive system. Okay, so I'm going to go through 2 questions and then I've got to skedaddle. And by the way, if you guys love my quarantine queen, this is navy and this is a rose gold print. They have all different types of prints, and this is available on Etsy. So I've got a link down below as well if you want my caffeine and quarantine mug. Okay. Oh, Leslie. Hey, Leslie. She says, good morning, Melissa. Any thoughts on how to treat yeast infection under the breast? So big thing with yeast infection, I would, one, eliminate whatever bra or underwire garment that might be causing that. I would use apple cider vinegar just to kind of swab that area after shower, before bed. And then I would also use the Happy Breast Balm, which has a whole bunch of really good herbals in it that would eradicate any type of yeast infection. Coconut oil, magnesium, iodine. Iodine is really good for that. But often the yeast infection can be indicative of exercise. Sometimes it's a little bit of a detox component as well, if that's the only space where you're getting infections. Instagram, we have 30 seconds. So let me run through. Do vitamin D and K and magnesium. Yes, very, very good. Let's see. Okay, let me run over to YouTube. Steph 23, what do you recommend for someone who just had a brain stroke? Periwinkle herb is fantastic. Instagram, come back. I'll answer a few more questions. All right. See you guys in a minute. So let's see here. And now let me save this. So periwinkle is an awesome herb for any type of stroke. The question is, because of the current state and existing strokes and COVID-19, I want to rule out COVID-19 and make sure that's not some additional blood clotting component. All right, bringing Instagram back. Instagram, hey, welcome back for part 2 of our live Q&A. Got YouTube and Instagram both on, and I'm answering just a few questions, and then I have to run a meeting with Gabriel's school, virtual meeting at 10:30. Okay, pickle juice for muscle twitching. Oh, that's interesting. Yeah, I would see that. Some of the vinegar and some of the fermentation there. Okay, so Steph, it's not in full script yet, but it is on my website. So if you go to my website, naturalhealthresources.com, if you go to shop, go my clinic, like the first line, click in there. Full script tends to be my supplements, although we might be trying to get them into our full script store. Let's see. Pao says, does anyone know of any safe estrogen detox supplement? It depends on what type of estrogen we're trying to detox, but I always like to balance it out with progesterone. Okay, Julie Catherine 20. I was 9 weeks pregnant yesterday. Oh, miscarriage started today. I'm so sorry, Julie. Herbs, supplements, ? Depressed but desperate to conceive again. Possible hypothyroidism. Okay, so just know, our bodies do this, and it is not to minimize your experience at all. But sometimes we just don't have all of the right balance of hormones. And sometimes it's just, things don't develop well with the fetus. It's hard to always know. 1, don't blame yourself. 2, take a deep breath and use this as a chance to implement self-care and to balance your body. The stress of COVID-19 and just stress alone could play into some of the factors of imbalances. But the most important point, what I would do is in about 3 weeks, I would have your hormones retested, test everything and see where you're at. Get your vitamin D levels tested. I do a micronutrient panel for sure. Test your cortisol. And, the big thing, herbs that I would employ or deploy. There's an herb called shatavari. It is an Ayurvedic herb. It is the herb for females. And this is for any of you ladies watching, regardless of your age, menstruating or not. Shatavari it's like the mother of herbs. It doesn't get a lot of love. It's just started to come out here in the American community and on shelves. But shatavari is great for recalibrating your hormones. It's great for women who are pregnant. It's great for post-pregnancy. It's great for miscarriages. It's great for everything. And shatavari will be the most impactful herb to balance you out. So I would send lots of shatavari love your way, and just hang in there, Julie. Julie Catherine 20. So let's give her some love. She's suffering a miscarriage today, which is so terrible. But just take some time and, just know that your body is detoxing. That's part of the miscarriage. What I wouldn't do any baths. I wouldn't do any, soaks or anything like that until you're fully clear. And really closely monitor the bleeding process. If you develop any clotting or anything like that, don't hesitate to call your physician. Okay, so let's see here. Best supplement. Let's see, I just lost it. Lori Preshaw says, best supplement diet for hypoglycemia. So minerals, and lots of fiber balances hypoglycemia. The big thing I would do is analyze your cortisol levels. With hypoglycemia, there might be hypoadrenal. Literally, we have like a lack of cortisol that can lead to it, or crashes. So I would test that first and foremost. but definitely minerals like chromium and selenium, those are my favorite. Michelle, can you look at my question? Okay, let me see. I don't know where it is. It's sometimes hard when I'm talking and questions come through. Let's see. Dorothy says, what do you recommend for BV, repeated yeast infection, and urinary tract infection? So I would rule out, so with UTIs and yeast infections, sometimes that can actually be interstitial cystitis, which is an irritation and infection in the lining of the bladder, internal and external bladder lining, which can register as often a yeast infection. So I want to clarify if you really are having a yeast infection, like a vaginal yeast infection, when it's paired up with urinary tract infection, they can be the same. Your thoughts on saunas? Yes, I actually, very excited. I have a sauna coming our way here, and I'm going to detail it for you all. So give me 2 weeks and I should have it all set up. But big fan, and I will dig into, there's all different types. Let's see. Also parasite. Okay, so Lori says, what do you do for chronic candida symptoms on and off that doesn't seem to clear? Also parasite symptoms. Can I take supplements without being tested? So, the big thing, Lori, if you're really dealing with a lot of chronic, and even if you think like there's candida and even parasitic pathogenic activity, I would do like a stool sample test. And identify and see, because sometimes there's other things going on where like the pancreas isn't producing enough pancreatic enzymes. Sometimes we can actually identify some really intense bacterial imbalances, and it'll give us the range and, severe, extreme, moderate, or mild grams in terms of the prevalence of these bacteria types. Because it's not always candida. Candida is one, and a lot of times candida gets blamed for everything, and it's sometimes some other bacteria type like Enterococcus or a particular type of E. coli or whatnot. So I want to dig further into that. All right, Candida 10. What is the difference between Hashimoto and Graves' disease? So sometimes the symptoms are the same, but they're autoimmune in nature. And what we find is that Hashimoto's can often be eradicated by diet, where Graves is a different bag. I do find that a lot of my Graves patients, they have a genetic predisposition, where Hashimoto's tends to be lots of stress, gut imbalances, and then that coupled up with, dietary, like a lot of dairy, a lot of gluten. When we eliminate gluten, and then we also do some liver detoxing, I can get people out of that range. All right, Whitney says, my dad had stage 3 kidney disease, high blood pressure, he's on 4 meds, and is very low in T3, T4, thyroid. Oh, he's only 56, he's young, and he suffered 2 strokes. We're working with a functional doctor to find the root cause, but any ideas you have to shed light on this problem would be greatly appreciated. We're getting his DNA, cortisol, micronutrient tests in a couple weeks. That's good. So, definitely the thyroid, T3 and T4, those are hormones that are actually synthesized by the liver. So more than likely he's got some liver potential sclerosis of the liver, fatty tissue of the liver. So I'd identify that. Synthesis is big in that. And the kidney disease, is it related to the high blood pressure or something different? I'd also assess to see if he's had any injury, maybe chemical injury as well. But yeah, that's the stroke thing too. Make sure they test his vitamin K levels, K2. And then also have them test the genetic links. I don't know if you're doing a genetic test, but I would test to see if he has any of the blood clotting factors. There are genetic predispositions to blood clotting. 56 and you've had 2 strokes, that's really high risk and likelihood that might be a factor. And that's a simple assessment and then ways we can deal with that. Okay. Brenda Omo. Hi, Brenda. How do I treat blurry vision? Just suddenly happened. My depth perception is off. If it suddenly happened, is it allergy related or inflammation related? And maybe cataracts. So that would be something I would assess. If and then also, are you getting any kind of junk or discharge from the eye with that? But I want to rule out that you haven't had any corneal or retinal damage or anything like that. Make sure your blood pressure levels are balanced. But blurry vision could be from a whole lot of different things. Okay, one more question and then I've got to run. Let's see. Sheila. Hi, Sheila. Hello, what herbal supplement or homeopathic remedies do you recommend to strengthen my kidneys? Okay, so actually yesterday's video is all on the kidneys. And I posted my favorite. And Whitney, you might want to check out yesterday's video. The description, there's a link for like my end-all be-all kidney support. I'm going to pull up that product here. It is called Kidney Plus. It's by Viratrex Bio. It's literally for any of you who is